Do we have a volunteer to read the land acknowledgement?
Elaine volunteered this time.
Oh, good. Thanks, Elaine.
We recognize and acknowledge the indigenous land on which we live, work, learn, play, and grow. This is the land of the Warm Springs, Wasco, Northern Paiute, Canino, Klamath, Olalla, and Yahuskin. We acknowledge them as the past, present, and future caretakers of this land. It is on their traditional land where we partner to improve the health and well-being of Central Oregonians. We aspire to be good guests, honoring the concept in the Warm Springs culture. This land is for you to know and live upon and pass on to the children.
Thank you, Elaine. Okay, so I know Elaine, it's been at least a meeting since you've been with us, I think. One of the things, maybe a couple meetings, one of the things we agreed on a couple meetings ago was that we were moving forward, just going to do introductions of CAC members and any guests or people who are joining us for the first time, and everybody else will introduce themselves in the chat. So we'll start with CAC member introductions. And Kelly, can you help us kind of make sure we track everybody?
Yep, I could help you with that. Well, Brad, let's start with you, and then we'll go to Elaine.
I'm Brad Porterfield, CAC chair, Community Advisory Council chair, consumer representative.
Elaine Navsi Schultz, Community Advisory Council community representative.
Let's do Ken and then Linda.
Good afternoon, Ken Wilhelm. I'm a CAC member, community member. I'm also with United Way.
Linda Johnson. I'm also a CAC member and a member of the Health Council.
Next, Mandy and then Maida.
Sorry, I just took a bite. Mandy Seeley. I use she, they pronouns. I'm in Sisters and I'm a consumer rep.
Hey guys, Maida Benitez, CAC member and consumer rep.
And then Teresa and Tom.
Teresa Olander, I'm a CAC member.
Tom Kuhn, CAC member and Deschutes County Public Health rep.
Great. That looks like that is all of our CAC members for today. We do have one guest, Mariana. You could introduce yourself, that'd be great.
Testing my mic, can you hear me?
Yes.
Awesome. So my name is Marina Cassandra, and I am filling in for Carolyn Black today, and she's had to be elsewhere. So I'm from the Oregon Health Insurance Marketplace. Thanks for having me. I think I can.
Thank you. And that is it for today for our guests and our CAC members.
Okay, and just we chose to do that as a way of saving time. It's the main reason. The meeting practices, I don't know if we want to put that up. I kind of skipped over that. I want to put that on the screen for people just to look at. I think pretty much everybody here is familiar with those, but if you want to take a minute to look at them, please do. And while you do that, let's jump into announcements. Actually, let me step back. I don't think, Carmen, have you joined a CAC meeting previous to today? Would you like to introduce yourself?
Sure, I'm happy to. I have joined the CAC meeting, but just thank you for inviting me into space. And I am the new executive director for Central Oregon Health Council, and I'm starting to recognize faces and names. And so that feels really good. And thank you for all the work that you do here.
Thanks, Carmen. So announcements, Ken Wilhelm, I believe this is your last meeting with the Community Advisory Council after, I don't know how many years. How many years has it been, Ken?
I don't know, several from the, almost from the start.
Yeah, I don't remember the CAC without you, so, well, thank you for all your years of service, obviously to the United Way. Ken is retiring, for those who don't know. Retiring from the United Way, and also this is his last meeting with the CAC, so. Anything you want to say, Ken? Parting words?
One thing I would like to say is that this is among the things that I found most important. Certainly, anything that wasn't exclusively United Way, this is the first priority for community work, and it's because of the work that we do, and it's because of the people that are involved. So I'll miss that.
I'm pretty sure we're gonna miss you. So thanks for all those years of service. And best of luck in your retirement. I think one of the other announcements is that we are going to be returning to visit our emerging issues kind of at our next, in our August meeting. We'll get back into looking at our emerging issues and tracking where we are at with the 2 to 3 issues that the members of the Community Advisory Council have raised and that we've started working on. So I just want to make sure everybody's aware of that we are not, that we're on course, and we want to jump back into that and make sure everybody understands where we're at and where we're headed as far as emerging issues go. And those are, for those who don't know, that's dental, periodontal, related to dental, but distinct care, and chiropractic care are the 3 emerging issues that have come up so far that the CAC is tackling. And I think there was a third one, and Kelly, I don't know if you could remind me. I remember there being 3, but I'm not remembering the third announcement.
The third one is that we're taking a summer break, so no meeting in July.
Thank you. So everybody heard that. We won't be meeting in July. Next meeting will be in August after today. All right, any other announcements? Okay. How about public comments? Anybody have any public comments? Going once, any public comments? Going twice? Okay. I'll actually share a public comment. Shared this with the board of directors of the Health Council at our meeting last week. I just wanted to call out and celebrate the fact that the Healthier Oregon program is starting on July 1st to cover all people, which is a result of the legislature and a bunch of people advocating, but the legislature passing the law to extend Oregon Health Plan Medicaid benefits to a portion of our undocumented adults who have been excluded from those benefits up until this July 1st. Yes, thanks, Teresa. And there's still, we're going to be having a presentation on it today, so I won't go into it. But Pacific Source is going to share information, or actually Rebecca from OHA is going to be sharing information about that today. It's something to celebrate, and we hope to see all people in Oregon covered, extended those benefits who are eligible soon as next year, hopefully. And we might be doing some advocacy on that. So I've asked the Health Council actually to consider, the Health Council Board, to consider drafting a letter and submitting a letter, making sure that the legislature knows that we want all people in Oregon covered and to receive those benefits. And so that's something that you could all think about and let us know what your thoughts are on that. Maybe in the section on Healthier Oregon later in this meeting. So last order of business before we jump into the other agenda items, approval of the meeting notes from our last meeting. everybody get a chance to look those over, make sure they reflect essentially what happened at that meeting accurately. And is there anybody who has any objection to accepting the notes as an accurate account of what happened?
I move to approve.
Okay,
That's Connor.
thanks, Connor. If there's no objections, and that's one of our meeting practices, is we're trying to be less formal about how we vote, but nonetheless give everybody an opportunity to express either positive, negative, express anything you'd like to express related to this, voting for the minutes being an accurate recording of what happened or not. So Connery, that was an affirmative. Are there anybody who has any problem with the minutes being approved as accurate? Okay. Thanks everyone, and thanks for whoever took those notes for doing a good job. All righty, let's move on to our breakout sessions.
Yeah, real quick before we do that, we had a couple of people join after introduction. So Connor is here and Stacy jumped in. If you guys want to just say hey.
Hey. This is Connor. I'm part of the CAC, and sorry I'm late.
Hi, sorry, I'm late too. I was at the GEM show in Prineville, which is really cool. If you live nearby, should check it out.
Nice. And then we actually have somebody else on the phone number ending in 4102. If you could introduce yourself.
Not hearing us, and I think Linda joined as well. If you want to introduce yourself, Linda.
Linda's been here.
I've been here all along.
Did you introduce yourself earlier?
Yeah.
Ah.
Hi, this is Rebecca Donnell. I'm also on the phone. I'm trying to log in via Zoom. I'm out in the field today, so I'm having a little bit of a connection issue.
Hi, Rebecca.
Thanks, Rebecca. Okay, well, today's breakout question is a little bit more on the fun side. Do you have any summer vacations or activities planned? We'll give you about 10 minutes or so, and I will send you to your breakout rooms now.
All right, well, hopefully everybody enjoyed that. I look forward to it. Let's go ahead and jump into Michaela with Community Health Projects.
All right, community health projects. So between last time that we met and today, I incorporated your feedback from last month, which those notes are in the meeting notes around application review process needing to be fair and objective, and that is really with the scorecard. But with the letter of interest, which we're now calling the pre-application, and I'll tell you why in just a little bit, I incorporated the feedback that you gave around having community input. All members of the community are represented, and then also communities know best of what they need to serve their community. And then also Buffy was kind enough to give some feedback as well, but I haven't included that into the letter of interest pre-application yet. I'll explain that in just a little bit. So let me share my screen. Okay. All right, so Gwen and I did some editing to this, what we're calling pre-application now. So remember, with the community health projects, it's a pre-application, just kind of high level information about what the project is or what the part of the program is that they're requesting funding for. And then the second piece of that is that the CAC will review these pre-applications and invite those projects that you're interested in or programs that you're interested in to fill out the full application, which has some additional questions in there, and decide on funding based off of the full application. So it's a two-step process. And so this is just the initial pre-application. And also we had a sub CAC meeting a couple of days ago, and I took this pre-application and scorecard, the updated one, to that small group. And so they provided some good feedback, and we did a little bit of editing. And then I also have some tribal feedback from Buffy, which is not included in that yet, but I do want to show you today some of that feedback to include and replace some of the questions in this pre-application. So sorry, it's a little confusing, but I wanted to show you this, and I'm getting a pop-up. Okay, so for this pre-application, one of the suggestions of the subgroup was to clarify that this is a two-step process. And so we'll be adding that into the announcement that goes out, and kind of detail out what that two-step process looks like, and making sure that's clear that this is only the pre-application. But we went through, we kind of simplified some of the questions in here, making sure that folks know that when they apply, it can either be for a project or a program. Based off of feedback, we changed this questions to reframe it as, which communities does the project include? And it includes different communities within Central Oregon, as well as the 3 tribes within our area. There's a space for folks to put other. And then for the amount requested, last meeting, Kelly emailed CAC members around if you all wanted to change that funding range. So wards could be funded, what's the minimum amount to fund and maximum. And there is consensus to keep it at that funding range will stay at between $5,000 and $80,000. We changed some of the language in the funding duration to hopefully clarify that these funds can be used to fund projects that have been going on for years, and to fund maybe a year worth of that project or a piece of that project. And then we have the basic information around project lead. These projects have to align with their regional health improvement plan. So we ask them to pick which area it aligns with and share how it aligns with the regional health improvement plan. Another requirement is that the project or program has to serve folks who are on the Oregon Health Plan. And then this question right here on serving tribal members, I'll skip over that because Buffy provided some feedback and some questions to replace this piece. Social determinants of health, asking them which social determinant of health their project aligns with. Again, that's a requirement. And then down at the bottom is where, first of all, project description, just an overview of their projects. And then the 2 equity pieces are where I hope to kind of capture what you're wanting to see included in these projects, around including the community, making sure the community is part of the project and planning, and that the community knows what's best. So the question is, how does this project meet the characteristic needs of communities experiencing health disparities based on geographic age, sex, race, ethnicity, national origin, language, culture, disability, immigration status, faith, gender identity, or sexual orientation, share what approaches they're using, and then explain how the people served by the project are involved in the planning and carrying out of the project. And this is just the next steps once they submit their pre-application. Subgroup, did I miss anything for the pre-application piece specifically?
I don't think you missed anything. I just wanted to comment that it seems very detailed, but very user-friendly. And it's a really good job. I'm impressed.
Thank you. All right. I'm going to move over to some of the feedback that Buffy gave me. And this is just some of the feedback. Microsoft Office was the suite was acting up. So there'll be more feedback to incorporate into the pre-application, into the process, but this is just some of it. And Buffy, please feel free to chime in or to share as well.
Yeah, no problem. Just let me know when you have it up, Michaela.
Okay, I have it up on the screen.
Okay. So one of the things that I kind of noticed last year, and it's everything in tribal work is always a work in progress, but sometimes I think that working with a sovereign nation, there's a couple of things that the Health Council is kind of working on, the CAC is kind of working on, or could be working on. And so there's like all of these different spaces and I guess maybe levels of making equitable pathways in order to learn how to support sovereignty and to support self-determination, as well as to be inclusive and understand with curiosity these other communities and these other organizations and governments. And so that's a lot. And so one of the things that I thought would help the education of the CAC, the education of the Health Council, is to begin to really design things so that we understand who it is we're working with. So if we're working with the tribal nation as a tribal nation, you guys need to know that and understand that you're dealing with a government rather than a nonprofit or rather than a different company. Does that make sense? And I can't remember, so somebody's going to have to say, yeah, Buffy, that makes sense.
I see some head nods.
Okay, thank you. And so I'm going to really suggest that as we move forward and the CAC and me kind of work together with this, with the Health Council support, that we think about that. And so I just kind of started to say there's really two pathways for tribal nations and tribal members and tribal communities and tribal citizens, which are all different. And so we really, you guys maybe this year can really begin to understand that difference. And I'm more than willing to do a section on that or a conversation at another time to get more in depth. But right now, as you can see, I kind of just want to begin to separate that out. And then I also want to be able to highlight for the CAC, if they're not a tribal representative and they have a working relationship, you guys need to be able to know and understand what that relationship is, because no more can we just, in my opinion, allow entities to say that they are doing something that they're not, because that continually, I guess, can make things complicated for tribes for exploitation, or just, you guys know I have really rough bedside manner, so I apologize for that. I'm not trying to offend anybody, but basically I'm just trying to reduce harm. Does that make sense?
Buffy, this is Linda Johnson, and it makes perfect sense to me. My question to you is, if there are the official tribal representatives as opposed to other people who are maybe members of the tribe or members of a nonprofit that has been created by the tribes, but they're not a formal tribal council member, is there a process within the tribes that we could utilize, maybe a letter of agreement or a letter of knowledge or some way to make sure that we know who we're doing business with and that the tribal council as a government is aware of this and supports it?
Yeah, Michaela, I think that's question, it's like the last question, and I outlined that.
Yeah, I have it up on the screen.
Okay,
published.
so, and so Pacific Source did an update on my computer. So when Michaela sent this out to me, I've been having issues trying to just get all of my applications to work correctly. So my intent was originally to map all of this out for you guys so that you could clearly see how things could unroll, so that you guys really knew when you were make a decision for, like, let's just say Warm Springs Community Action Team, which is a nonprofit community-based organization inside of the reservation. So if Warm Springs Community Action Team decided to apply for a new project, you know, they have the support of tribal council, or do they have the support of another partnership from a tribal program and department? See, these things are important to your decision making, because you may find out that, oh no, this organization doesn't have a working relationship, that they haven't even necessarily begun the internal process. And so that, does that help?
Yes, so that helps a lot.
I think it's critical, Buffy, because otherwise I think we're trying to you're helping us educate ourselves, so we're preventing basically fraud. You know, if you're an organization that doesn't really work, or it's an idea or whatever, yeah, you should not be claiming it until you're actually doing it. And I also think we're trying to be respectful of a culture we don't necessarily understand, or I don't necessarily understand, but want to. So yes, I think the more educated we are, the better off we will be. And I really appreciate it.
Thank you. And I really appreciate the opportunity just to do this education piece, because, you know, as you guys all know, I've nothing but worked with tribal nations and tribal people. So sometimes my learning, I've had to kind of relearn, like, how do I educate on a really complex, basically, existence in a way that is complementary to what you guys are wanting to do. And so I appreciate you guys being very willing to be with me as I bushwhack around in here and try to make some headway so that eventually my hope would be over time is that we would all be able to come to just more understanding and that shared learning. So thank you.
Thanks, Buffy. And thank you for sharing the importance of this and educating us and helping us with this process.
Hey,
I'm
this
gonna-
is Michaela. Could I ask a question?
Yeah.
Hey, Buffy, this is Brad. So how, and maybe this is something to, you know, this is a continuing discussion and process we're gonna work out, but I'm wondering how we are, what is the best way to confirm what an applicant is telling us in terms of their relationship with the tribe?
So for those individuals and organizations that have worked on projects directly with the tribe, and we'll use the Treehouse Therapies. So Treehouse Therapies actually has a memorandum of understanding and agreement with the Early Childhood Education Center to complete a single project, so that they should be able to produce that for that single project, which will give a duration and a time frame and a point of contact of the tribal representative that's working with Treehouse Therapies. And it also will kind of just, you know, it'll just outline it basically. And so also a different way is like you have Central Oregon Community College, you know, traditional health worker department, I don't know if it's a department, but department might have a letter of support for a new project that's emerging that they want to do. And they can include all of that dialogue or all of that exchange with their application to show that they're actually working towards, you know, the end result of an MOU or an MOA, or does that make sense? So there's all different levels of development. And some of them are just ideas. And so they might not have a letter of support. They might not have, because it may be maybe the idea doesn't even ever exist yet. So they're trying to get maybe community forums or community feedbacks, or eventually they'll try to figure out how to maneuver, or maybe they have none. Like it's just, they just think that it might work for that community, but they don't have any relationship. They don't even know how to begin. And I say none because I've gotten calls from people inside Deschutes County that are nonprofit organizations who have said, hey, I want to do this in Warm Springs, Buffy. How do I do that? And I've also gotten calls from nonprofit organizations that say, Buffy, I think this would be really good for the community. And can you tell me, you know, who to contact? Which is great. And then I've gotten some calls that have said, Buffy, I'm doing this in Warm Springs, period. And when I try to inquire and ask more information, it's just, no, this is what we've decided we're doing. And we're going to go drive down there. We're going to do it. And that's just the end result. And so what I'm trying to provide for the CAC is the education and understanding that that you guys have a very important role in building tribal relationships, and I just want to make sure you have it all so that you can make an informed choice. Does that help, Brad?
Yeah, I appreciate that, and very much. And so, again, this might not be the right time, but I'm going to ask, and you can answer or not. Is your recommendation that we not fund any project that doesn't have some kind of written confirmation about their essentially permission from the tribal council?
I think that's a conversation that needs more information and education around it, Brad. So that
Okay.
I would never want to make such a harsh line without dialogue and without a shared understanding with either the CAC, with the Health Council, with maybe some Pacific Source input, who knows? And so I think that would be yet to be determined, but I think that that's a perfect question to ask.
Okay. I appreciate that. Thanks.
All right, let's look at the scorecard draft.
I have a question.
Yep.
The two questions about technical assistance and a grant process orientation, is that something that could also benefit other groups? Like, should that be a general question on the pre-application? And I'm thinking like new nonprofits that may not have the money to hire a grant person, people who this might be the first grant they're applying for. So just throwing that out there, because I think those are really good questions.
Yeah, we can state it in the announcement and also put it in there for folks to take advantage of.
And the reason why, just so that you guys know, the reason why I put it in here is because I've been watching this process, and it is so foreign if you're a tribal government. And so that was partially trying to always extend equity to tribes, and I know that the Health Council is trying to figure out how to do that, not just for the tribal nations, but for just exactly what you're saying. So thank you. I appreciate the support there.
Thank you. All right, so here is the draft scorecard for the pre-application. We made a lot. This is totally different than what you had last year, but we're hoping that this is a little bit more robust. There's 3 different areas. So we have the project description overview, which includes, is it easy to understand what project plans to do? Is it clear how this project positively impacts the social determinants of health in the community? Is it clear how this project positively impacts health equity in the community? The second piece is really that second section of the pre-application around those 2 questions of the project includes strategies to meet the characteristic needs of the people being served, and then that this project prioritizes people from communities experiencing health disparities. And then the last piece is asking about the budget. So the amount of funding requested makes sense for the project description. One change from last year is we're going to ask for a draft budget from applicants in the pre-application, so folks feel a little bit more comfortable answering, is the amount that they're requesting in the ballpark of what makes sense given the description. And Buffy, I would like to get your feedback on this as well, maybe offline or in the meeting if you'd like. I know we haven't had a chance to talk about it yet. So we wanted to keep the scoring pretty simple.
I have another question.
Go for it, Mandy.
In looking at the list of health disparities, I don't see any way to capture people experiencing poverty. Is there a way to do that without necessarily saying poverty, class.
So socioeconomic status.
Yeah,
Okay.
that's good.
I have a follow-up to that. If the money has to go towards people who are on OHP, that may establish already I guess an income level.
That's a great point. I didn't think about that.
Yeah, so the requirement around OHP is that the project has to serve folks on OHP. There's not any restriction that it has to serve, like the majority of their project have to serve OHP members, if that makes sense. So they have to be open to those who are on OHP.
And the other thing, we can pull up our definition of people experiencing health disparities, underserved folks, because it includes all these with the caveat that poverty is both a cause of and a result from the list that's included here. Because what we've found, to my observations over the years, since I'm speaking for Gwen Jones here, is that as applications come in, people will say, well, we're serving people with in poverty. All of the projects are serving people in poverty because that's, who we're providing grants to. The question is, how are they modifying, adjusting their project from serving just one population type, white dominant, to other folks that are have disabilities or brown or black or LGBTQI and those kinds of things that have experienced even greater levels of being underserved and pushed out of systems. So that's the caveat. That's why we've pulled that poverty specific out. But we have a whole bottle of language around that that's making itself up into the Health Council website here shortly.
Any other major changes? I'd like to share the timeline with you. Okay. New share. There we go.
Just about that scoring. I have a quick question. So the scoring is something out of 20. So are we, and there's 3 criteria. Are we supposed to just randomly say, oh, this is an 8 or this is an 18 or?
Yeah, so how well, based on those 3 criteria, how well does it meet those 3 bullet points and given a score out of 20?
It's on a slider scale, is the way it's been built. So you slide along and say, well, if it's really high, I'm going to put it in this range. If it's not so great, put it down in this range.
Okay.
All right, so for the draft timeline, we're hoping to launch, to send out the announcement by the 21st. And I'll be working with Buffy to get those, the feedback put into that pre-application before we send it out. So that might be adjusted just a little bit. But we're wanting the pre-applications due August 2nd by midnight. And this timeline, it follows the same timeline as last year. So with the LOIs, there is a little bit of a tight turnaround, but it'll give more time for entities to complete that full application later on. And we're really wanting to get the final decisions made in November. So that way we don't run any risk of not meeting the funding deadline, getting funds to these organizations by the end of the year. So in August, applications are due at the start of the month. The 2nd, we want to turn around and have the those applications, pre-applications out to you by the 3rd. And they'll ask that the scores are due by the 15th of that month for you to make a decision on those pre-applications at your August 18th meeting. And then we'll notify the applicants by the 22nd. And then they'll have until October 17th, which I think is a little bit over 2 months, to fill out those full applications. You'll have 2 to 3 weeks to review those full applications, score them, and then at your November meeting, make the decision, and we'll notify the applicants by the end of the month, by the 21st. And I'd like to meet with set up some time with the subgroup to go over the full application, to kind of work on that, as well as the review process between now and then. Questions? Thoughts?
Hey, Michaela, this is Brad. My only thought is, as someone who writes a lot of grants, it's my opinion that it actually takes more time to do the pre-app. This pre-app is essentially, it's almost a full application. There's not a whole lot left out of the pre-app. So you have to have your whole, your thinking pretty much lined up and expressed for the pre-app. There's actually more work for the pre-app than there is for the full app, in my opinion. So how that's reflected in the timeline might be worth consideration.
Yeah. So the latest that decisions can be made is November. We wanted to make sure that there was enough time for the full applications for entities to be able to get approval for them to fill out to submit a full application. And that's why we left the full application time frame a little bit longer.
Stacy's got a question there in the chat.
So what you said was something that I brought up, and it was clarified in the subgroup meeting that if picked, all that information that they already spent time on is then transferred over to the full application. So they're not like starting over again.
Correct.
So, right. Okay. Cause for me, I'm like, oh man, if I had to do 2, like, I don't think I'd want to, but then it was clarified that, at least there's like, my understanding is a little bit of time is cut with doing the pre-app. So if they're not, picked or approved, then at least they didn't have to do the full thing. And then if they are, then all that information they already did is just transferred over, was what I got from the clarification the other day.
It looks like Gwen said yes to that. Yeah.
Okay.
Yeah. Yep. Yeah. Brad, do you mind if I check on that to make sure like which piece? I just want to make sure that like entities, when they're applying, if shrinking like the full application turnaround in exchange for lengthening the pre-application, if that would cause any issues with organizations and approval to actually start applying.
Yeah.
Okay.
Yeah. And the other piece, this is horrible, but the other piece that we're trying to balance too is giving you all time to review the pre-apps and the applications and the volume that can come with it. So there's all those different pieces too.
Yeah, I mean, in truth, there shouldn't be nothing should really change between the pre-app and the full app as far as like the essence of the project and whether it meets fits with the priorities of our application. But so in my mind, and that's the way I think, at least. So the full application shouldn't take very long because you're kind of already like, we
Do you-
already did this. in the
We
pre-app.
did follow up with CAC over email on that piece, on the timeline and adjusting the pre and the full applications.
Yeah, and if there's, I mean, it's not a battle that, I care to fight. It's just an experience I wanted to share as a grant writer.
Yeah.
And just in terms of the timing.
Okay.
So if there's anybody you want to check with, it can be the CAC, it could be anybody else. And I know you want to get the announcement out soon, so. Any other thoughts on that? We're kind of at time with the health projects, but we'll give another minute. Anybody else has input on that, comments? Any of this?
Brad, I
Yeah.
just have I have one question for the CAC. I was able to do some touring with Caroline regarding the shelter and also the call center. And I was wondering if you guys on the next meeting would like to see pictures.
Yeah, please.
Okay, thank you.
You see the audience, the rest of the group. I know you can't see everyone.
Yeah.
That'd be great.
So Michaela, are we okay moving on, or is there something critical we need to also accomplish?
Yeah, and we'll follow up over email about the timeline and see if we can address that piece.
Okay.
Thank you, everyone. We'll stay in touch.
Thanks, Michaela. So is Rebecca with us? Remember.
I'm here, Brad.
Oh, Rebecca Donald. I was looking for Rebecca Berry. Did we switch the
Okay.
order notes? Rebecca Berry with us?
She's not, but she has a recording for the CAC.
That's right. So we're switching the order.
Yeah, Rebecca Danell will go first.
We're going with Rebecca Donnell first. Is that correct? Am I
Yes.
freezing? Okay. Go ahead, Rebecca Donnell.
Okay. Hi, everyone. I'm Rebecca Donnell. I'm an innovator agent with the Oregon Health Authority External Relations Division. I work with the Pacific Source CCOs in Central Oregon, the Columbia Gorge, where I am right now, and the Willamette Valley. And I have recently picked up also supporting HealthShare in the Tri-County area, in the Portland metro area. And I'll be handing over my responsibilities to support Pacific Source to Dustin Zimmerman, who had previously, before I was hired, supported Pacific Source. So this is sort of bittersweet because we're not having a CAC meeting in July. So there'll be some transition meetings and I might be around in August. But if not, this is a great group and this is a great presentation to dismount, so to speak. My pronouns are she, her, just so everyone knows. So today I'm going to talk about Healthier Oregon. Some people refer to it as Cover All People. That was the initial name of the program. It has been established as Healthier Oregon and will be Healthier Oregon going forward. Next slide. So in terms of background, in 2021, the legislature passed House Bill 3352, which expanded Cover All Kids to include adults, hence why it was originally called Cover All People. But within that, there was a $100 million general fund expenditure cap. So they had to, in the program implementation phase, make some decisions around that $100 million cap and how they were going to make sure that they stayed within that cap. And we'll talk a little bit about that. OHP coverage will supplement the existing federal funding that covers medical emergency for individuals on CALM or citizen waived medical to provide full benefit package that covers primary care, behavioral health, prevention, dental, and other services. So sort of the baseline population will be CALM and CALM Plus members moving over, but other people within the age groups are also eligible regardless of their citizenship or immigration status. Next slide. So starting July 1 of this year, people who are 19 to 25 or 55 and older, including pregnant members, will be eligible for full Oregon Health Plan benefits regardless of their immigration status. This means that adults in those age groups who had not been eligible for full Medicaid due to immigration or citizenships requirements previously will be eligible after July 1st. I'm going to pause here to see if there's any initial questions. Is there anything in the chat? Okay.
Out of curiosity, Rebecca.
What's that?
Out of curiosity, why is including pregnant members highlighted or called out specifically?
Because it's part of the CALM benefit. Most folks that were enrolled, so it has to do with basically people being enrolled in CALM previously. And so just making sure that people understood that people who had previously been in CALM or CALM Plus are moving over and will have full OHP benefits.
Okay.
Okay, next slide. So what to expect? So people 19 to 25 or 55 and older who are enrolled in CALM or CALM Plus will automatically move to Healthier Oregon and will have full OHP benefits. And they'll enroll in their CCO starting July 1, 2022. So if they've been CALM members within those age groups, they automatically roll over to the Healthier Oregon program. And they started receiving letters in May to let them know that this was happening. And starting June 21st, they'll be receiving outreach calls as well. In addition, people who meet the eligibility requirements who may not have met them previously because of their immigration status can enroll in Healthier Oregon July 1. So if someone had applied for OHP previously and they weren't enrolled in CALM or CALM Plus and they were denied OHP mainly because of their immigration status, they can reapply. They need to reapply. That's what I'm underscoring, that they have to go through the process again to reapply. And as long as they meet the eligibility requirements for all the other eligibility requirements, including income, they'll be eligible for OHP. Thank you, Tanya. CALM stands for Emergency Medicaid. CALM Plus is full OHP benefits for pregnant members who would, if not pregnant, only be eligible for CALM Emergency Medicaid. Next slide. What to expect? So this is a little bit outdated, this information. The public health emergency had been scheduled to sunset April 15th, and then President Biden extended it to July 14th. States would have been notified 60 days in advance of the sunsetting of the public health emergency, which meant that Oregon would have been notified May 15th. And because May 15th came and went and Oregon was not notified, we know that there will likely be an extension of the public health emergency now out to at least October 15th or 14th, which means that the earliest that redetermination would begin is November 1st. it may begin later than that, and that the extension may go beyond October 14th or 15th. So what that means is that basically people won't be impacted by the public health emergency starting in July as we previously thought. Next slide. We've been busy at Oregon Health Authority working on outreach and communications. There's an awareness flyer and FAQs that have been uploaded to this website, oregon.gov/healthieroregon. The webpage and materials are also available in Spanish. We're doing community presentations. That's why I'm in the gorge today. I was doing the same presentation out here. There's Facebook Live and other social media announcements. And as I mentioned before, those letters went to Callum and Callum Plus members. And that's about 12,200 individuals that have received letters and will receive phone calls prior to July 1. Next slide. This is the overall timeline. We're way down at the bottom. We're still in the outreach and engagement phase. We're about 2 weeks before the start of Healthier Oregon. July 1st is when coverage begins. We're heavily in the outreach mode. Just to emphasize again, anyone that was in Callum or Callum Plus will automatically roll over to full OHP benefits. It's individuals who may qualify but weren't part of Callum or Callum Plus who should reapply starting July 1st. Next slide. So I'll take questions. The other piece that I want to briefly talk about is that through our Community Partners Outreach Program, we have a grant program for community partners to participate and support outreach and enrollment in Healthier Oregon. At this point, they've received applications and narrowed down the application pool. They're still working on final notifications to those awardees. And Tanya, I don't know if you have any updates around that, but those should be coming soon. The idea is that we will have community partners that work directly with the community that would be eligible for Healthier Oregon to be able to talk to folks, reassure them about the program and enrolling in the program, to help them navigate how to do that and answer questions. And to really hopefully provide some benefits to families and individuals who had previously not been insured. Questions?
Rebecca, maybe since two of us are on this call already, we can let everyone know that they're on the announcement list of those outreach engagement organizations awarded a grant. We only have one grant for Central Oregon. It's actually a partnership combination grant of LCA, VIM, and Mosaic. So love it. Brad, my partner here in action, and we're doing a unique kind of spread of the efforts across Central Oregon, of course, engaging Neighbor Impact and others in the community. And we're pretty excited for this new initiative.
Yeah, thanks, Elaine. And that is Latino Community Association of Volunteers in Medicine and Mosaic Medical. We all went on a proposal together and got awarded. So we're looking forward to doing the work. Yeah. Any other questions or comments for Rebecca or in general?
This is a pilot program, and so this will really, it was developed and enacted by your legislators, and so important to advocate for this program as it is being utilized. And then obviously there's the question of why not everyone? It really has to do with that cap. And so I think we want to make sure that people take advantage of this program, enroll in the program, utilize the benefits so that people can really understand how this will impact communities in a positive way, and also where the gap is and where the continued need is. And so it's really important to speak up in support of the program going forward, as this is a pilot.
Yeah, thanks, Rebecca. Yeah, there's that gap of 26 to 54-year-olds, which is the majority of that, those folks that have been excluded fall into that. So it's great that more people are being covered, provided benefits, but there's still a big chunk of folks who are not. So yeah, we have the opportunity to advocate to make sure that everybody gets coverage, which means more funding. Yeah.
If you have questions, I'm going to put my info in the chat. You can always reach out to me. I may not be the person who knows the answer, but I'll find the answer for you and get back to you. It's been my pleasure to serve the Central Oregon CAC and your region for the last 18 months. And I just thank you.
Thank you, Rebecca. Appreciate it. All right, well, we are quickly running out of time. How long is Rebecca Berry's video?
Her video is about 17 minutes or so.
I'm wondering if we could start it, and then if folks have to leave early, we'll go ahead and send out the link to the video for everyone to view afterwards as well.
Yeah, so I guess if you're able and willing to stay, stay, and if you need to go, go. And thank you for being here when the time comes. We have 8 more minutes of your time. Please give us 8 more minutes of your time. If you can stay. No volume for me. Are other people hearing it?
I have no volume either.
No audio.
Yeah, me neither.
Where did she record it?
Garage, insulating the ceiling in hopes that it's going to stay cooler this summer when it gets hot and warmer.
Can
this
everybody hear it
winter
now?
when it's really cold?
Yes.
In order to keep my bikes that I love so much protected. So I hope you're having a really good meeting today, and I'm looking forward to sharing a little bit about the progress of the Regional Health Improvement Plan with you. And I hope you all know that you can get in contact with me at any time if you have any questions. So I'm going to start off with a few questions for you, actually, to see if you got some information from the progress report that was submitted to Oregon Health Authority. So I'm going to share my screen. There we go. So let me move my image here out of the way. So as of today, how much of the $12 million set aside for the 2020 to 2024 Regional Health Improvement Plan has been invested? Is it A, 2.5 million, B, 6 million, or C, 10 million? I'm going to pause and ask Michaela or Gwen to pause the video so you can all put in your guesses.
What's everyone guesses? What are everyone's guesses?
Come off mute, throw it in the chat. We want to hear from you.
And the progress report that she's referring to was sent out with the meeting packet, just so you have it.
And random guesses are welcome as well.
Throw it in. Stacy says 6 million. B, 6 million. 6 million. All right, let's see what she says.
Okay, if you're back, you're ready for the answer. So the answer is, oh no, it's not working. 6 million. So as of today, we've invested about half of the $12 million set aside for the health improvement plan, which is really exciting. All right, next up. To date, about how many mini grants or grants $5,000 or less have been awarded supporting this current regional health improvement plan? Is it 12, 45, or 70? And I'll pause again to let you all have a discussion.
What do folks think? 12, or I'm seeing lots of 45s, 170 from Linda. How many mini grants? 70?
I'm going to say 12 just to be ornery.
All right.
All right, if you're back, you're ready for the answer. So get ready. The answer is 70. So to date, we've had 70 small grants, $5,000 or less, awarded through the Regional Health Improvement Plan. And these are not the separate COVID mini grants that we also awarded. These are just mini grants supported through the Regional Health Improvement Plan. All right, last question. How would someone learn more about a project funded through the RIP? Ask a COHC staff person. B, whisper the question to their smart pet. Or C, look under what we're funding on the Central Oregon Health Data site. I'll pause and let you all discuss this.
Brad says definitely A, ask a staff person. Linda says C.
Thanks, Myra. I'm with you. My smart pet. I don't know if that's electronic pet, smart pet, or just my pet that happens to be smart that day.
All right, if you're back, you're ready for the answer. And the answer is C, look under what we're funding on the Central Oregon Health Data site. So I'm going to share actually the Central Oregon Health Data site. So I suspect most of you have seen this already as we've looked at it. And this site is actually where we're tracking all the progress of our regional health improvement plan. And keep in mind, there's only a couple of staff people that are helping to make sure things are up to date. So sometimes there is a delay, but we're really trying hard to make sure that it's up to date. So you can go to centraloregonhealthdata.org to find this site. And it's broken up into a lot of different sections, but to go to the section that we just talked about under what we're funding, you can look here and find currently funded projects. So there are community projects, there's what we're learning and currently funded projects. What we're learning shares about projects funded through the previous regional health improvement plan. And currently funded projects are all the projects that are being funded through the current regional health improvement plan. So you can see here, there's a number of different projects that we've loaded in. Tons and tons and tons of them. And I still have about, 14 more to add. I'm working really hard to get these added. But if we look at one of these, we can look at this one here. You'll see that it shows the start and end date of the project that was funded, the aim or kind of big objective or goal of the project, a little bit of information about the project, what work group or priority area and what future state measure the project supports. And both of these are linked so you can actually see these things in more detail. For example, this measure on increasing fruit and vegetable consumption. So this is focusing on fruit and vegetable consumption for youth, 11th graders. And so this shows information for 11th graders. It shows the Oregon data, the Crook, Deschutes, and Jefferson data, because these are the data points that we have for the whole county. And then also 8th grade data points. And you can see it'll show how we compare to Oregon as a state. So in Crook County, they're doing slightly better than the state of Oregon. How we looked over time, so compared to the last data point, and it looks like Crook County is doing slightly better than the last data point. But unfortunately, at this point, Crook County has not met their target in the health improvement plan of 38%. So they're still striving to increase that data point. If we go back to this page, we'll see that there's a lot more information. It'll show who funded the project, how much the project was funded for, and who received that funding. And if we wanted to learn more about the measures in the priority area of promote enhanced physical health, we could click on this Learn More section and it would share a lot more information about those measures. This shares a little bit about what this project wanted to accomplish, a description of the project, how this project addresses equity, and then lastly, the objectives that are measured in the project. And looking at these are just summaries of the objectives. The specific measurable objectives will be reported out in detail after the completion of their project. And a reporting timeline, so when you can expect to have some updates shared around this project. So I hope you'll go and take a look at this currently funded project section to see some of the projects that are being invested in for the Regional Health Improvement Plan. In addition, we have a lot of different ways to look to see if we are meeting or getting closer to the measures of the Regional Health Improvement Plan. Each of the 6 priority areas can be found under priority areas, and a person could click on one of these priority areas. So address poverty and enhance self-sufficiency, and they'll see all of the measures that are being tracked underneath this priority area. Information on why those measures are important, and then some additional information on what we're learning about economic stability and education and built environment, all things that are impacting addressing poverty and enhancing self-sufficiency. Down below, it's got information on mini grants, promising practices, which are things like strategies that have shown to have great outcomes, and ways to get involved. So it talks about when the work groups meet and how someone could actually start becoming involved. And then there's some information on national funding opportunities down here. But going back up to those measures which we're seeking to track, if we click on one of these, it shows what the data looked like when we published the health improvement plan in January of 2020, and what we want to see it move toward by December of 2024. And if we wanted to see more detail about this data, we just click on that blue box and it will take us directly to that measure that's being tracked in the data site. And you can see we can actually look at the most current school year that we have data for all the way through until the oldest school year that we have data for. We can look at this information by the state or by the 3 full complete counties we have data for. So oftentimes when we don't include Northern Klamath County, it's because we cannot get data at that partial county level. So looking at this, if we wanted to look at, say, Jefferson County, we can see that currently we've actually met the target that we wanted to see for graduation rates among youth experiencing economic disadvantage. So the target for the health improvement plan specifically for Jefferson County was seeing an increase to 83.4%. And right now, Jefferson County is at 87.2 from last year's school year. It'll be interesting to see what we discover with an update from the 2021-2022 school year. But as you can see down here, this is showing a nice upward trend of more and more students graduating in Jefferson County, which is fantastic. So this is one way that we can look at the measures of the health improvement plan. Another way is to go over into Explore Data and search for data. And this is my favorite section because I can type in any keyword and I can get all kinds of measures that are associated with those keywords. But that's something to do on your own time. But if you scroll down, you're going to see there's a lot of different what we call dashboards that have been put together for people to refer to. So we have things on food insecurity, mental health, adults fully vaccinated from COVID, Northern Klamath County measures. And then you'll see here at the top, the 2020 to 2024 Regional Health Improvement Plan measures. And if we click on this, this is a collection of every single measure in the Regional Health Improvement Plan. And we can see exactly how we're doing on each of them. And as we said, that green check mark means currently we've met that end goal that we were trying to reach of improving that measure for that particular section. But with an update in data, that may change. So this could change based on what we're seeing. And you can see down here, food insecurity, we're not meeting that measure in Crook County at this point. So we want to decrease it. We're pretty close. Right now it's 13.1%, but we want to see it below 13%. So you can just scroll down and kind of get a sense, and all of these are linked. So if I wanted to get more detail on food insecurity for Jefferson County, I could just click on Jefferson County and it would take me directly to the detail of this. So if you want to explore this, it's a really fun site. There's no way that you can mess it up. You can click on anything and check it all out. But we're really looking to be updating this and making it more easy for folks to take a look at. There's 2 more things I wanted to share before I end my time with you. The second thing is if you wanted to find out more information on the Regional Health Improvement Plan, you can go to cohealthcouncil.org. So that's the Health Council site. The reason why the Central Oregon Health data site is separate is because we want it to be a community or region-owned data site. And so we have a separate website for Central Oregon Health Council. And underneath our work, we have the health assessment and health improvement plan. Underneath the regional health improvement plan, we have updates. So we have the current plan right here, the executive summary. And the cool thing about the executive summary is all the measures are now linked to the data site. So you can go to this executive summary and choose a measure, and it will link you directly to the data site. So this is linked. So I just click on it and it takes me directly to the data site. Thanks, Camille, for doing that. And then you'll see we have last year's progress report that was submitted to Oregon Health Authority, and then the current one that you received in your packet. So this information can be found here. One last thing I want to share is that we just launched our Central Oregon Community Needs Survey. And so I think you received some information about that last week from me. We need your help getting this out into communities. So let me know if you want us to print some flyers that you can share with community members. They're available in English and Spanish. And so the survey is available in English and Spanish. And we can also print the surveys and collect them at later dates if that's something that folks need. But we really want people to be filling this out because this is how we're gonna see what is important to our communities in Central Oregon. And that's gonna help us inform the next regional health improvement plan. So please, please, please help us get this survey out into communities. All right, that's all I have for you today. I'm looking forward to talking with you soon. Have a good rest of your meeting. Bye-bye.
Nice job, nice job. Well, thanks everybody who was able to stay for staying. And have a fantastic summer. We'll see everybody in August.
Thanks, everyone. See you in August. Staff will be here.
I noticed that Stacy put a question in the chat real quick.
Oh.
Oh, I was gonna end up emailing Michaela or someone.
Okay.
Or Rebecca, but my thought was for the survey, getting that to Housing Works and seeing if they'll post it on most Epic properties have like a bulletin board that's weatherized for the people that live there, and maybe with a QPR code so people could take the survey. Just as a thought. And I know the manager for Epic, Roger, so he's also on the board for Fuse. Those are, he would be a really good person to touch base with, I think. Anyways, that was just my thought.
Good idea. Good idea. All right, see you guys. See everybody. Take care.
Bye. Thanks.